emotion, a victory in motion. Home of knee repair, not knee replacement.
Gel is just kind of a generic name. People call them rooster comb shots or whatever, but really it's hyaluronic acid. So hyaluronic acid is big in the cosmetic industry nowadays. And hyaluronic acid does come from rooster combs originally. Now, a lot of the companies make it genetically engineered bacteria in the lab or in a factory, but it originally came from rooster combs. So if you want to get your own natural supply of hyaluronic acid, you can eat rooster combs. Sounds kind of gross, but I've actually had them. If they're prepared right, they're not that bad, but I digress. So anyway, hyaluronic acid is the main component of our joint fluid. And so we have fluid in all our joints. It's lubricating. It's kind of like a motor oil. And so as we get older, and especially as we get arthritis, that fluid thins out. It's not as good of a lubricant. It's not as viscous as it used to be. And part of that is because the knee is inflamed. And when it's inflamed, it produces more thinner fluid. And so if you don't have as good of a lubricant in there, that kind of rough surfaces or bone on bone is gonna even rub more and be more painful. And I'm simplifying things very much so. But bottom line is, when we get arthritis, the fluid in the joint thins out. It's not as good of a lubricant as it used to be. So they make these artificial joint fluids, which we inject into the knee with a needle, and it thickens up the fluid kind of like a motor oil change. And it also stimulates your joint to produce better fluid, so it tends to last longer than a cortisone shot. It also doesn't have the nasty side effects that cortisone has. It doesn't increase the blood sugar or increase the risk of infection or any of those things. So it's definitely safer. In my mind, it definitely lasts longer. I have used hyaluronic acid injections since the 1990s. Interestingly, insurance companies are paying for them less and less, which I think is ridiculous. And it's anywhere between 1 and 5 shots. In my experience, by the way, the 5 shots would be once a week for 5 weeks. But there's single shot brands, there's the 2-shot brands, there's 3-shot brands, there's 4-shot brands, there's 5-shot brands. I don't know of any more than that. But if with the 5-shot brand, you would have to come in once a week and get a shot into your knee for 5 straight weeks. My experience over 26 years is if you're willing to do that, it will last a little bit longer. If you do the 1 shot, it'll work. But in my experience, it doesn't last as long. Some people might argue with that, but I've done a gazillion of these injections over the years. Personally, I find PRP and bone marrow work way better because they last a lot longer. In general, the gel injections or the hyaluronic acid injections are going to last 6 months. Now, yes, they can last longer or they can last less than that. And there's some people who they don't work on at all. But in general, they last about 6 months. They're not going to grow new cartilage back. They're not going to do anything for the underlying bone problem. But they can help thicken up that joint fluid and make your knee feel better. So those are not a bad option at times as well.